All right, we're going to start. Good morning. We want to thank everyone for being here today. Today, the region of San Diego takes a positive step forward in the effort to increase our health system capacity. We are pleased to announce today that due to the help of the federal and state government, the San Diego County region has been selected to receive a mobile field hospital unit, and in great partnership and collaboration with Palomar, that facility will be sited right here. This 250-bed facility will increase our regional capacity and increase our ability to meet our regional healthcare need. We talk a lot about flattening the curve. The second part of that is raising the bar and raising our health system capacity. This unit comes with the stuff that you need in order to expand your health system capacity. We've talked as well about how in addition to the stuff, you need the structure and you need the staff. And we are incredibly grateful to Governor Gavin Newsom and the state of California for selecting San Diego to receive this 250-bed capacity of stuff. We are incredible to the Department of Public Health, the Army Corps of Engineers, and the federal government. But we are equally grateful to Palomar to provide the structure and the staff. This really is a collaborative effort. This is a great partnership. And we are pleased at how rapidly this has come together. And again, we appreciate the cooperation of the state, the federal government, our healthcare systems, and the broad coalition of folks that you see standing behind us. There are a number of efforts like this, but this one is certainly one of the most significant and one of the most promising. This will be a regional facility. These beds will be regionally available for anyone who is in our need. But again, this gives us a great opportunity to move forward. We've been in multiple conversations with the governor, with the state of California, and again, we appreciate their selection of San Diego to receive this site, and we in particular are grateful to Diane Hansen and the entire team here at Palomar for all of their efforts to quickly facilitate doing something that is very difficult and very hard. And so it is a testament to our partnership, collaboration, along with the daily efforts that we all take around both flattening the curve and raising the bar of our health system capacity. With that, I would like to introduce my colleague, Supervisor Kristen Gaspar, to talk about the efforts that are taking place in her area and in her district. Thank you.
Well, thank you, Supervisor Fletcher, and thank you for all that you've been doing at the forefront of our regional response to this global pandemic. There's an old African proverb that says, if you want to go fast, go alone. If you want to go far, go together. Today, San Diego is defying all odds by going faster together. I'm proud to be here this morning as a key partner in today's announcement of a 250-bed federal medical station that will be housed at Palomar Medical Center here in Escondido. This new regional asset is the result of a multi-agency partnership brought together by leaders from all organizations to ensure our region is prepared. We are securing the critical components for the regional medical response necessary to adequately care for our community. For many years, we have been working together across jurisdictions to increase the capacity of our healthcare system. You saw this with those that had chronic and behavioral health needs. I was listening this morning to Governor Cuomo's press conference. He was talking about some of the lessons learned. He said for the very first time, the hospital systems had to work together, both public and private. Well, here in San Diego, we've been ahead of that. We started it with building the capacity with behavioral health systems here in San Diego. We started it with Live Well San Diego back in 2010 when we stated the government can't solve the most complex challenges here in San Diego alone. We would have to rely on the rich network of businesses, nonprofits across San Diego County. And these are the very people that are coming together to help us with this health crisis. I'm very proud that we're ahead of other jurisdictions because of it. Because of this ongoing collaborative approach and the commitment of the Board of Supervisors, the county has built strong relationships with our hospital partners already. Today's announcement is an example of what can be done through strong relationships and leaders who are committed to protect the people of our region. With the support of the state and federal government, the federal medical station will provide the stuff we need to expand our regional capacity to confront this virus with a strong system of care to keep our communities safe. I'm proud to work with partners at all levels of government to secure resources on behalf of San Diego County residents. I'm proud of the members of our community who have reached out to me and to the county to share your ideas and express support for our regional efforts. Keep those ideas coming. I wish I could say that we will not need this additional capacity. I wish that were the case. What I can say is that today we are better prepared than ever as a region. With that, I would like to introduce you to Palomar Health Board Chair, Dr. Engel. Thank you.
Good morning. It's a privilege to be here today. I would like to express how proud I am that we can be part of the solution to fighting this pandemic for all of San Diego County, not just our local community. As a practicing anesthesiologist, I see firsthand the challenges we are all facing day in and day out. This is why I believe bringing this field medical station to San Diego is such a vital part of managing this crisis. We need to be prepared no matter what the surge level is in the coming weeks. It is with great humility that I stand here this morning representing my fellow board members and our hospital system with its physicians, nurses, and other critically important staff. It's an honor for me personally to be able to work with our administrative team here at Palomar. It's with gratitude that I accept with all of you the challenge we have before us. Working together, we can make an important difference. We will get through this, and we will be better on the other side in many meaningful ways. Thank you, Supervisor Gaspar and Supervisor Fletcher, for your unwavering support for Palomar Health in this operation. And thank you for this opportunity to serve. With this, we'll again, with honor, have Diane come up. Thank you, Diane.
Good morning and welcome to Palomar Medical Center. It's absolutely our pleasure to host everyone today. I'm honored and humbled by the responsibility of taking on this federal medical station for the county. Our mission to heal, comfort, and promote health in the communities we serve are the words we live by each and every day. And this is one more opportunity for us to fulfill our mission. Palomar Medical Center Escondido was built to meet the needs of a growing community. And the 2.5 shelled floors were intended to accommodate future growth. How fitting that the 10th and 11th floors can now be used to meet a more critical need within the community, a 250-bed federal medical station. We are proud to be a part of the solution to keep our community safe. While there are other locations throughout the county for a medical station, this facility is ideal since it is a fully functioning hospital, which means an easier transition to making a hospital within a hospital operational and get it up and running. At Palomar Health, we've been closely monitoring the coronavirus situation since January. No one could have foreshadowed the impact this would have on people around the globe. Fortunately, these are situations for which we prepare. Our frontline healthcare workers here at Palomar Health and around the country are the true heroes. They continue to selflessly step up and step forward to help the community. And they will again show the compassion when the medical station becomes operational. I could not be more proud or more confident that the employees will provide the high quality care in this federal medical station, a premier level of care that our community has known and trusted. Since February 7th, we have tested over 1,000 patients at our hospitals and will continue to provide care to the community until this virus has been eradicated. This is what we're here for. It is just what we do. I would like to thank Supervisor Gaspar and Supervisor Fletcher for their unwavering support of the work we do each and every day. Both reached out to me directly to offer support to our health system, even beyond this particular project. This station coming to us could not have happened without their support. I'd also like to thank Director Mascione for the collaboration, partnership, and support as we have worked through this effort. He and his team from the county have been incredible to work with. And I'm going to mention a couple of folks that I know have worked with me directly. Jennifer Bransford-Coons, Andy Peace, and Robert Sills, we appreciate you. While we get to stand here and be a part of this incredible announcement, we know that it takes an army of teammates to bring this to fruition in such an expedited manner. For Palomar Health, I'd like to thank Sheila Brown, Dr. Omar Kawaja, Carlos Bojorquez, Mel Russell, Jeff Washburn, Dan Farrow, and their teams who have really been the boots on the ground. Your efforts are so greatly appreciated. As I said earlier, we believe in our mission to heal, comfort, and promote health, and appreciate the opportunity to serve the entire county. Thank you. I think now we'll take some questions.
Can you help me understand sort of the parameters of what this is going to be? You said 10th and 11th floor. Is this COVID patients only, non-COVID? Who gets to go up there and who staffs it?
Okay, and the question was who, the parameters for the medical station, and who will be treated. So I'm going to turn to Dr. Nick Ifantidis to respond to that question.
Thank you, Diane. First, I want to say Hosanna to all my fellow believers and answer the question as follows. We are so fortunate and blessed to be living in a part of the country that is forward-thinking, innovative, strategic, and united. With regard to the specific utilization of this space, it will be used for those in our community who need it the most in a coordinated way with all of our health system partners. Being a federal medical station, this is a community-wide resource. We already have in place an orchestrated system, if you would, an air traffic control system that is already existent. This federal medical station will be now part of that. And as we have talked about over and over again, there is structure, which this facility is in existence, the amazing idealistic opportunity of putting this stuff into the structure in support with staff. The patients that will get their care here will be the ones who need it the most, and it will be coordinated in the routine established mechanisms that we already have as a region. Thank you.
Before you step away, I'm sorry, I still don't understand. Who goes up there?
The question is, I'm sorry, I still don't understand who goes up there. Currently, the capacity of our region, because of the proactive steps that we have taken, is actually so enhanced that census and utilization today is very low. Over the coming weeks, as the storm begins to hit our region, the decision of who exactly will go there, the details of that, will be decided and coordinated accordingly. We are going to reach a point, if we are not there already, of the level of community transmission that there will be no such thing potentially as COVID and non-COVID facilities. Because of the dynamic of asymptomatic transmission, it is very likely, and we will be making the assumptions, that this space, a hospital within a hospital, will be used accordingly. The last thing I want to say and clarify, we have already the tables of the CEOs, the chief medical officers, the chief nursing officers, led by my own colleague, Dr. Denise Foster, the care coordinators and case managers from every health system. As the utilization and demand for health care in our region increases, that is the time that those exact decisions of what type of patient will be made in terms of appropriate and ideal stewardship of this incredible regional opportunity. Thank you.
Does this bring in more ventilators and ICU beds? Is this essentially just adding 250 beds to the entire hospital community in this region, or is this?
So the question is, does it bring more ventilators or is it just additional beds? So is there more equipment coming? And I can tell you, I'll let Dr. Nick respond. My understanding is that, it will be the beds until we actually see what it comes and shows up here. Then we'll have a better idea once it's offloaded what will be there. But Dr. Nick, I will defer to you.
Thank you for that question. I'm actually going to invite my colleague Rob Sills, the director of our medical operations in our Emergency Operations Center, to answer some of that question. Again, it gets to the structure, stuff, and staff consideration. Brother Rob, would you like to make a few comments, please?
Yeah, so I believe the question had to do with all the equipment that goes with the facility as well as ventilators. So we have, we track the total number of ventilators and other equipment that are in our region daily. And when there is a need, we shift the resources around to fit the need. And this will be no different. The cash that comes from the county as well as from other facilities, we take it to where it's needed most, and this will be no exception. We don't know exactly what is coming until it arrives with the shipping manifest, because everything's happening really fast with FEMA and the state. We have a good idea, but we are ready to supplement if needed.
Who staffs it and who picks up the cost?
Both great questions. As far as staffing, Palomar Health will staff the field medical station. We are still working through, the details on funding, so I can't give you specifics, but Palomar Health will staff the medical station.
And when will it be ready, up and operational?
When will it be ready and up and operational is the question. And we are working fast and furiously with the county, side by side, trying to get this up and in operation as quick as possible. I will turn back to Dr. Nick and Rob to see if they have any more clarity.
Yeah, and I, again, will have a tag team here with Rob in a moment, but let me make something very clear, because these are all fantastic questions, and we, as always, are being proactive and transparent and announcing this as soon as we have the confirmation so that we can do our planning accordingly. The timing of its readiness versus the timing of its utilization are two separate considerations. I want to repeat how mindful we are that with the proactive things that we have done as a region, elective surgeries, looking at these amazing new models of care provision, the census and the utilization of our regional healthcare system is literally at a all-time low as far as the timing in which we've done data tracking. This facility may be available sooner than this facility will be utilized. And that goes back to the air traffic control, the regional partnership, and the coordination that we are all so very committed to. In terms of logistics, Rob, with regard to the process and so forth, if you could please make some comments about that. Thank you.
So as I believe it was said earlier, there are a number of these federal medical stations going up in counties all over California. We are on a priority list. The next step is that the trucks will be loaded. There are about 5 53-foot semi-trailer trucks. They'll be loaded, and they will head here to the